saya bawa anak saya pergi ke salon rambut, kemudian hairdresser tu lepas dah siapkan rambut anak saya semua, dia tanya tak ada ubat ke. So macam memang kadang kita akan rasa macam like soalan tu sangat sensitif, and then macam rasa macam macam orang tu rasa kita tak cukup usaha.
I think masa tu you akan fikir, oh my god, tak ada soalan lain ke? You tak tahu ke autisma ni neurological condition?
It's important to remember that autism or whatever the neurological condition the child has or the person has, there's only one thing, one facet of the entire human being.
Yes.
Kan? So anak autism pun sakit perut. So kalau sakit perut, bagilah ubat sakit perut. Right? Anak neurotypical pun sakit perut, ubat dia sama.
Yeah.
So whether you're autistic or not, the ubat sakit perut is the same. Hai, salam sejahtera. Selamat datang ke episod ke-30 Kita Family Podcast. Di podcast ini, kami membincangkan perihal yang berkaitan dengan makna serta kepentingan hidup bermasyarakat, menghargai keunikan serta kepelbagaian sesama kita dan meraihkan masyarakat yang berbilang agama, kaum, kepercayaan, rupa dan juga keupayaan. Kita menghargai hidup secara inklusif yang mengambil kira keperluan segenap lapisan masyarakat, terutama bagi mereka yang kurang atau berkelainan upaya. Hai, nama saya Desiree dan bersama-sama saya di studio hari ini, Anit.
Hello.
Dan dari Kota Kinabalu, Sabah, Didi.
Hai, Assalamualaikum.
Hari ni dua orang tak dapat bersama-sama kami, iaitu kakak kami SK dan juga Nori. Tetapi mereka kirim salam mesra kepada semua penonton dan pendengar kami. So hari ni kami akan membincangkan beberapa topik dan segmen ini kami pernah buat sebelum ni pada episod ke-26, di mana kita memanggil episod-episod macam ni Chit-Chat Mak-Mak Neurodivergent. Kan? So topik-topik ni biasanya daripada our interaction dengan fellow parents dan sesiapa sajalah yang tanya soalan atau memberi pendapat tentang autism or anything to do with neurodivergence. Kan? So hari ni kita akan bermula dengan salah satu soalan atau perbincangan yang sebenarnya sangat kerap kami lihat dalam media sosial dan juga antara kawan-kawan, whether it's parents or people who are not parents with neurodivergent children, berkaitan dengan ubat atau vitamin. Bukan atau, dan ubat dan vitamin, kan? Dan kami semua tahu bahawa autism ni sebenarnya tak boleh diubatilah. It's a lifelong condition. Just want to preface that. It's a lifelong condition. It is a neurological condition. Kan? Memang tidak boleh diubati autism tersebut. Intervensi, terapi boleh membantu dalam day-to-day interaction, living skills. Tetapi perbincangan kami hari ini maybe khusus sedikit tentang ubat atau vitamin yang berkaitan atau ada kaitan secara langsung dengan autism. So maybe kita boleh bermula dengan Didi. Ada tak pernah dengar apa-apa tentang ubat atau vitamin yang berkaitan dengan autism?
Okay, ni pengalaman yang sangat baru. Beberapa hari yang lepas, not even a week ago, saya bawa anak saya pergi ke salon rambut, kemudian hairdresser tu lepas dah siapkan rambut anak saya semua, dia tanya tak ada ubat ke. So macam memang kadang kita akan rasa macam like soalan tu sangat sensitif, and then macam rasa macam macam orang tu rasa kita tak cukup usaha. Sebab kan kalau kita kebanyakan penyakit bila bagi ubat akan jadi lebih baik.
Yeah.
Itu pun tujuan ubat kan. Kita ambil ubat untuk kita jadi lebih baik, untuk kita sembuh, untuk kita kurangkan penyakit yang ada. So bila orang tanya tak ada ubat ke, Jadi ialah sebab kita pun dah lama kan, dah berbelas tahun dah anak kita dapat diagnosis. Jadi ia bukan lagi satu soalan yang membuatkan saya rasa sentap lah. So boleh jawab dengan tenang dan boleh cakap lah, autism tak ada ubat, tapi saya bawa anak-anak saya untuk pergi terapi. Dengan terapi inilah yang boleh buatkan dia boleh berkembang, boleh improve. Mungkin sebab bila kita kata improve tu, ramai orang anggap improve tu sampai jadi normal. Kan? Close the gap and then jadi normal dah, tak nampak autistik dah. Tapi sebenarnya walaupun umur meningkat, ada lagi kemahiran lain yang dia perlu belajar. Kemudian sebab cara berfikir pun lain, kemampuan pun berbeza dengan anak-anak tipikal. Of course, terapi ni sentiasa diperlukan dalam bentuk yang berbeza. I think kita dah pernah bincang dalam episod yang lepas. Ada kan kita pernah cerita pasal terapi, adakah terapi tu lifelong, and then kita bercakap bagaimana bentuk terapi tu berubah mengikut keperluan anak tu sendiri. Jadi saya terangkan secara ringkas lah yang anak saya bawa ke terapi, tak ada ubat. Tapi kalau orang tanya ada beri apa-apa suplemen atau vitamin ke tak, of course ada bagi, tapi tujuannya bukan untuk merawat autism. Ia adalah untuk kesihatan secara general. Contohnya vitamin C untuk tingkatkan imun badan. Kemudian kita bagi probiotics untuk melancarkan penghadaman. So benda-benda macam tu, sebab mungkin orang anggap kita memberi ni untuk merawat autism, tapi for me, bila yang saya lihatlah pada anak saya, bila kita optimalkan kesihatan anak kita akan lebih mudah untuk belajar lah. Kuranglah rasa, dia akan menjadikan dia lebih selesa dengan badan dia. Sebab kan waktu kecil-kecil dulu, masa tak berapa nak boleh bercakap, kalau sakit perut pun boleh meltdown. Kalau sakit badan tak selesa, tak boleh nak tidur. Bila tak boleh nak tidur, tak boleh fokus nak belajar. So benda tu sebenarnya mempengaruhi kehidupan seharian. Tapi ramai orang sangka ia berkaitan dengan autism. Dia bukan dia punya autism tu jadi kurang ke apa, tak. Tapi kita kena faham, kita membantu anak kita untuk jadi sihat dan selesa dengan badan dia, supaya bila kita hantar pergi terapi, hantar pergi kelas, dia mudah belajar dan menerimalah apa-apa yang diajar di sesi-sesi tersebut.
Betul? Ya, so saya nak balik sedikit kepada soalan yang Didi terima tu kan, from the hairdresser. Didi, sebab cara saya, from the way you are telling us, Didi, cara dia tanya soalan tu bukan dengan niat yang tak baik, kan? So cara dia tanya like memang dia curious, like they want to know, kan? They like really want to know, can it? Ada ke tak ada? So betul? Didi tak rasa marah lah.
Tapi ada ketikanya kalau kita dalam keadaan penat ke, kita punya emosi tak stabil, orang tak ada niat pun kita akan terasa juga.
Memang. Sebab sensitif kan? I think masa tu you akan fikir, oh my god, tak ada soalan lain ke? You tak tahu ke autisma ni neurological condition? That might be a normal reaction. And that's not wrong either. You know, sometimes you just feel that way.
Correct.
Because it's been a bad day and you just out there getting a task done, like getting the haircut. And hairdresser kadang-kadang can be quite talkative.
Depending on the hairdresser. That's why it's recommended to go to the same person who knows you.
Yes. And who the children are comfortable with. So, I mean, it's good, Didi. That means they found a hairdresser that they are comfortable with. Yeah.
Absolutely.
In KL masalahnya.
Tak apa. Buat kawan baru di KK.
Yeah.
Boleh je.
Yeah. So anyway, back to ubat and vitamin. Sekarang kita pergi kepada Anit pula. What are your thoughts, or what have you heard, or any discussions you've had on it?
Okay, so autism can exist with other coexisting conditions. I wish Kakak was here because she would be the real authority on this. But we have found people with autism who have epilepsy, sawan. Ada yang ada ADHD, hyperactivity. Ada yang ada some other things like skin disorders. Some have very sensitive skin. And these are all coexisting conditions that even a neurotypical child will have or can have. Okay? But when you have it in a child with autism, those conditions perlu dapatkan rawatan. Okay. Sama ada mereka sembuh atau tidak bergantung kepada the treatment plan, condition tersebut, whether it's optimized, or sometimes kadang-kadang mereka mempunyai lelah atau asma. That's very common with younger kids. Macam Didi sebut tadi, kena ada vitamin C untuk meningkatkan imunasi badan. Kadang-kadang ada doktor pun yang akan suruh give them fish oil. So you know, I remember I had to have cod liver oil when I was growing up, and it was like, tak ada flavour masa tu tau. Yang putih tu. Sampai tutup hidung pun tak boleh. Tak boleh telan. Tapi niat ibu bapa untuk bagi suplemen tersebut adalah untuk meningkatkan imunasi badan. Dan supaya kita tak sering sakit, boleh pergi ke sekolah dan participate dengan semua aktiviti dan memang okay. So it depends on the coexisting conditions. So as Didi and Desiree said, autism is a neurological condition that we are not looking for treatment, we are not looking for ubat. But kalau ada other coexisting conditions yang tu perlu diubat dan perlu bawa kepada doktor dan dapatkan rawatan yang perlu dan ambil ubat seperti yang diberi oleh doktor. Yeah.
Yes, betul. I like that you brought that up, Anit, tentang the comorbidities atau other things that are going on with our kids. And I think it's important to remember that autism or whatever the neurological condition the child has or the person has, that's only one thing, one facet of the entire human being.
Yes.
Kan? So anak autism pun sakit perut. So kalau sakit perut, bagilah ubat sakit perut. Right? Anak neurotypical pun sakit perut, ubat dia sama.
Yeah.
So whether you're autistic or not, the ubat sakit perut is the same.
Ubat lelah is the same. Nebulizer pun the same.
Exactly.
Spray same. Inhaler sama.
Sama, betul. So I think for me, like from my personal experience, autism is just one thing, one facet of Hans, tetapi dia memang ada cabaran-cabaran yang lain, tetapi because of the autism, it was harder to detect. Tapi it's not impossible.
Yes.
Kan? So contohnya, he had a tongue tie masa dia baby kan. And I didn't know sebab I was a first time mom and I couldn't breastfeed. I thought one of the reasons was because I did an elective C-section. So, but actually later on, 2 years later, I realized, so it was actually both. Maybe my supply datang lambat. At the same time, the child could not have that motion, right, to breastfeed from the mom. So we only discovered it when he was 2+, kan? And sebab Hans was a fussy eater, dia only eat certain things, minum lebih susu. So there was no instance for us to actually see yang dia ada tongue tie until he was 2+. Baru nampak, kenapa lidah dia lain? Right? But the treatment that he needed is same as any other person.
Any other child with a tongue tie.
Yes. Tetapi yang kadang-kadang berbeza sikit lah because of the autism, mungkin dia tak faham. This can actually be done as an outpatient procedure, tetapi because it's a bit harder to explain, so he has to go under general anesthetic. So kena masuk ward. Right? Other things that he had were like was a glue ear. Kan? So basically fluid in the middle ear. We could have found it out earlier. If he was able to communicate verbally, but that was not an option for us. So we only found out when he was 4. Right? Tetapi lepas he had that, and so the treatment for the glue ear is the same regardless sama ada you're autistic or not.
Yes.
You have to drain the fluid from the ear and insert grommets so that it can drain completely. So the point here being that the Autism or ADHD, whatever the neurological condition is, one facet of it. Tetapi when there is other medical conditions, the treatment is the same. That's when you treat.
Yes.
Kan?
Yes. So what I also like is when you say that sometimes it's just more difficult to detect. Okay. And this is why I think kalau kita pergi kepada klinik kesihatan ataupun kepada doktor untuk ikut schedule vaksinasi, kadang-kadang mereka akan check juga pasal benda-benda ini.
Yes, betul.
Yeah.
They
So when that happens, it helps the parents, especially first-time parents. Sebab kita tak tahu kan, suddenly we have a baby in the house and the baby is already controlling your life. And as they grow about, they're controlling it even more. And you don't know that there could be other coexisting conditions. So, like what you said. So a tongue tie could have also been an impediment to speech yang lancar.
Yeah, betul.
Yeah.
Yeah.
So I think the speech and language therapists also will always inspect the mouth to tell you that. But that's when you see a speech and language therapist.
Betul.
Yeah.
Yes.
So
But
for a neurotypical child also could be speech delay due to such a condition.
Correct.
Yeah.
Yes. So it's also about going through sometimes the process of elimination lah. So the next point I'm trying to make is that while our kids have other conditions as well, like sakit perut and whatnot, we still cannot 100% separate the fact that they're autistic because of the autism, sometimes it's harder to detect. Right? For example, like Hans' case, because he's non-verbal, he can't speak, right? Even for our speaking children, sometimes they don't know how to describe it if something is wrong, right?
Yes.
Yeah.
And those with sensory processing disorders may have a heightened sense of itchiness, a heightened sense of pain. Tapi that is because of their...
low.
Low.
Yeah.
Low. Yes, Didi. Kan? Kadang-kadang orang lain akan rasa, this one would be sangat sakit. Tapi budak tu okay je.
Their pain threshold, some of them is higher. Kan?
It's higher. Bukannya tak sakit, tapi it's just because of their neurological condition and their sensory processing, they have a heightened or a lower
Sense of
feeling
feeling.
pain.
Correct.
Yes.
Correct. So why don't we talk about another famous topic selalu kan, since we are talking about ubat, vitamin and whatnot. The other one that we can't overlook is the talk about pregnancy. Kan? Saya sendiri pernah kena and I've spoken about this publicly as well. Masa Hans dah diagnosed, I was having stomach issues. Ada seorang general practitioner, a GP, a doctor told me to my face, your son is autistic because of you. Sebab masa you pregnant, you makan apa saja yang you suka. So let's talk a little bit about that. I'm sure Didi and Anit have heard something along these lines. So let's go to KK dulu.
Yes.
Apakah pendapat Didi tentang topik ini?
Well, there was one time I received a DM dalam Facebook tau. Someone, fellow parents lah, tanya whether I would consider a third child. Like, like you guys know that I have two autistic children, right? And like, that's the thing. Like, dia macam, of course, it's about pregnancy, genetic, and everything. And for someone to actually ask me, dia macam, I don't know, as if I knew for sure what had caused my two children to be autistic, betul tak? As if I can do things differently to avoid our third child to be born autistic as well. So it was a very difficult question, very personal as well. I think like I don't think a stranger, someone you don't really know personally, should ask that kind of question.
Yeah.
Kan macam, oh, what you want? But my answer at that time, I did answer lah because the same question also popped up in the Autism Malaysia Facebook group as well. What I said was the thing that determined whether we wanted to have, we wanted lah, because like this the ship has sailed. Like now, like not at the age of like considering anymore. Whether we have the resources to keep providing to the girls that we already have, the autistic children that we already have, and what if the third child is also autistic? So having three autistic children would do we have enough resources untuk membesarkan mereka, untuk to even take care of them? How about myself, saya sanggup ke tak nak ada another baby in the house, at the same time busy driving the two girls pergi sekolah, pergi therapy and whatnot. So that was the answer lah. Like because I couldn't kind of like say what people can do differently during pregnancy to avoid having children. I mean, having autistic children. But of course, banyak conversation, banyak like when we look back on what had happened kan masa pregnancy, and also like reading, doing all the readings from the research and like people posting online. It seems that there are things that can increase the risk, but increase the risk, but not necessarily be the cause. Because macam people can see the correlation tau. From the research that people made, they can see a number of people who like exposed to this ke apa ke, and then end up having autistic children. Tapi it's not a definite cause. They just see the number kan, nampak this group has higher chance of having autistic children. So there's tak boleh nak cakap lagi what you can do differently, what you can need, because you can see kan macam ada family yang all children either autistic or ADHD, ada yang family yang anak ramai seorang je yang autistic. So it's hard, unless you do the genetic testing, and of course the genetic testing is getting more advanced by the day. You can get more answers, more like to see what are the cause of each person punya autistic kan, dia punya ni, each person, not to say the cause of autism in general, like for everybody. Even like my two children, I'm sure can't really say that Afia because of this, Amy because of this, because kita pun nampak the traits are different, although they came from the same parents kan, same upbringing, same environment. They have different traits and everything. So susah sebenarnya cakap, and macam mana, if you really read up, you really like talk to people, you really like dah ada exposure to what experts are saying, you still tak ada dapat satu jawapan or satu advice yang you boleh bagi to other mothers lah. But I think at the same time, of course, the thing that you can say is to optimize your health lah while you are pregnant. Kan?
Yes. Yeah.
Anik, you want to add on that?
Yeah, I think you got that spot on, Didi, because there's nothing specific that you can do, but any sort of event that would have an assault on the lack of oxygen to the child, that is neurologically damaging. That is proven by science. So that we can say for sure, right? But when things happen in utero, means when you're carrying the baby, it's a lot of mystery. So I remember older people saying that it is a very difficult time for both the mother and child, because you really don't know, and this is like kata orang-orang tua tahu, anak tu pun seksa tahu sebab dia terbalik, they are eating what the mom is eating. Kalau dia tak suka apa yang makan pedas pun dia tak boleh cakap tak nak. Dia perlu makan kan apa yang mak makan. But the development is then ultimately part of the growth and as you said, genetics. And we don't have an answer. It's one of those things that will remain a mystery until science catches up. And it sounds a bit like cancer was a couple of years ago when they couldn't tell you what causes it, but when it got caused, it, or when it appeared, it seemed to have such a stigma. So, but today it's like, as long as it's of stage 1, stage 2, and most of the time stage 3 is treatable, let's do our best, let's intervene early. So similarly, autism's going through the same thing. So kalau nak tanya, nak buat benda lain masa pregnancy tu, I think it's best to go and ask your ONG. we are not the authority here, and I haven't come across any literature or anything that will tell you except keep happy. And as Didi said, kesemua anak memang semua lain, personality lain, perkembangan lain, and kalau mereka ada special needs pun atau neurodiversity or in any way, it's also of a different level. As Nori always says, when you meet one person with autism, you meet one person with autism. There are no two people who are exactly the same. So if within the family as well, there's more than one person who's neurodivergent, it can be so different.
Yes, look at Didi's daughters.
Didi's daughters are,
completely different.
The classic example. Their personalities are just poles apart.
Amazing. And even in neurotypical siblings, just because you came from the same parents, tak semestinya personality semua sama, rupa pun tak semestinya sama.
Oh, memang tak.
Kan? I always get this question, you seorang ke dalam keluarga you putih macam ni? And my answer is yes, it is. So it's different for everyone. And like what Anit said, and also Didi said, I think bila kita mengandung, any expectant mother lah, just look after yourself. I don't think any expectant mom wants to intentionally do things that are harmful to themselves or to their child, right? And so like Anit also said, there is no exact science to it. And even if we talk about genetics, kan tadi Didi ada cerita sikit tentang genetics. To my knowledge, there are no genetic tests to detect autism in vitro or before the age of 1.5 years old. There are no genetic tests. In fact, autism will not show up in a blood test.
No, it will not.
Right?
Down syndrome will.
Down syndrome, yes. So, especially for those, and I know I've had this conversation before with other parents who've done things like IVF. I've talked about my IVF journey. The embryos can be tested for certain things like Down syndrome is one of them. Right? But autism and neurodivergent conditions like ADHD, dyslexia and whatnot, those cannot be detected in vitro. So I think it's very important that we're clear.
Yes.
On that.
In fact, I want to share this thing that happened during my second pregnancy. I did the normal 3-point blood test and it came back saying I was at a high risk of Downs. So then the doctor did the next thing. The clinic called and said, doctor says you need to come in for amniocentesis, where they actually put a needle into your womb to extract some fluid to send it for a very specific test, which is a very conclusive test. And while it happens very quickly, there is a very minute risk that procedure itself can cause a miscarriage, right? And so we would obviously the anxiety levels were up. I was sitting outside, and my husband just turned around to me and said, "Why are we doing this?" And I looked at him and I said, "Oh, because we need to know." And he goes, "What? So if you know what, are you going to terminate the pregnancy?" I went completely silent and I thought for a while and I said, "No." Then he said, "Okay, if you're not going to terminate, then why?" And I said, "Well, then I'm prepared." And then he left it. So at least I had an answer. But for a while, I actually wondered, did I need to know?
Yeah, absolutely. Yeah. So I think there's something to be said about mystery still. I'm a bit old school, kan? When you watch movies and all that, some people, they don't want to know the gender of the baby and all that. So I think let's also think of it that way when we are pregnant. And for some women, it's a magical time.
It is.
You're pregnant.
It is.
You get pampered. You can eat what you want. You don't worry about the weight so much.
Oh, you do. Some doctors will tell you, don't put on so much weight. Nanti pergi test untuk diabetes.
Oh yes, that was me. But
I pun kena.
Thankfully, Also because last name is Kaur, right? So they kept
Yes.
testing me for diabetes like 3-4 times. So anyway, I think we'll go for a short break.
Yes.
And we'll be back shortly. Hai, selamat kembali ke episod ke-30 Kita Family Podcast. Hari ini kami membincangkan topik-topik dalam segmen Chit Chat Mak-Mak Neurodivergent. Sebelum break tadi, kami telah pun discuss sedikit sebanyak tentang vitamins, ubat dan juga masa mengandung kan, some of these assumptions dan sebagainya tentang wanita mengandung dan autism. So sekarang we will change it up a little bit.
Yes.
A bit more on a lighter note, taklah serius sangat tetapi serius jugalah sebab considering di Malaysia dan di negara-negara Asia, akademik ni memang sangat penting.
Yeah.
It becomes a sort of like a very competitive thing for any parent actually with children, right? Apalagi bila anak ada autism. So kadang-kala we see a very wide spectrum of that pun. So ada yang the minute you say autism, ini mesti kanak-kanak genius ni, mesti pandai maths or pandai art or pandai something. Tetapi ada juga extreme di mana people will ask, anak autism ni boleh belajar ke? Boleh tak berjaya dalam academic? So let's open it up as we used to say on Clubhouse, popcorn style. Siapa nak start first? Didi ke Anit?
Okay, I start first.
Okay.
We have to be grateful now sebab memang walaupun ada diagnosis, Kementerian Pendidikan memang ada menguatkuasakan zero reject policy. So dengan zero reject policy, kesemua anak-anak walaupun ada keupayaan atau tiada kurang keupayaan boleh mendapat pendaftaran di sekolah kebangsaan. Tetapi adakah mereka boleh berjaya dalam bidang akademik adalah secondary. Yes. So, you boleh pergi ke sekolah, boleh bercampur gaul, boleh ada kawan dan ada berjumpa dengan budak-budak lain, tetapi akademik ni dalam anak neurotypical pun kita tak boleh janji semua anak neurotypical pun will succeed academically. So we have to take it in context. Kalau ditanya adakah anak yang neurodivergent tu boleh belajar? Memang boleh belajar. Tapi tahap dan dia punya skill untuk cepat tangkap dengan a lot of repetition tu, yang tu berbeza. So you have to just look at their ability. Their ability to learn is there and their ability to absorb is there. But how they translates atau nak menjawab soalan dalam peperiksaan itu adalah cabaran kepada segenap lapisan anak-anak neurodivergent dan untuk yang lain mungkin tidak. Dan ada yang boleh belajar kalau dalam kelas yang kecil, ada yang boleh belajar dalam kelas yang besar, ada yang boleh berjaya dalam bidang akademik dan pandai mengambil peperiksaan dalam dewan yang besar. Tapi ada yang perlukan kelas yang kecil atau separate room bila menduduki peperiksaan. So that's why we always say with education there has to be accommodations.
I like that you also said that with neurotypicals, kan ada yang memang excel academically, ada yang memang don't really excel academically, but doesn't mean they are not smart.
Yes.
Memang everyone has a level of intelligence. And I would like to now remind everyone that autism is not an intellectual disability.
It's not.
Kan? Sekiranya seseorang tu ada intellectual disability, is a completely separate learning disorder. Memang in some cases of autistic having intellectual disability ada, tetapi it is not berhubung kait dengan autism.
Ya, bukan kesemua anak-anak autisma mempunyai masalah pembelajaran.
Yes.
Dan ini datang daripada Desiree yang selalu membagi tuition dan mengajar anak-anak.
But also if you look back dekat DSM-5 yang memang diagnose all these neurological conditions, intellectual disability is not in the list, or a low IQ is not in the list of autism. Sama juga dengan dyspraxia and things like dysgraphia, it happens most of the time in children or people with average to above average IQ.
Yes, it
Tetapi
does.
it goes undetected sometimes because, and balik kepada tadilah kan sebelum break, we said that because of the autism, it's harder to detect kan. So when there are other things like dyspraxia, dysgraphia and all that, it might be harder to detect. Tapi it does not mean that intellectually they're impaired.
Yeah, so the ability to learn, like sometimes they have dyslexia. And dyslexia in a neurotypical child will be picked up much faster because you will expect them to by a certain age to have certain skills. But in a child who is neurodivergent, you might take a bit longer to actually find that that is a coexisting condition together with the autism.
Yep.
And it may be masked because you are so fixated in trying to get them to follow rules and to be in the group and to do that you may overlook the fact that there may be a coexisting condition.
Betul?
And yang tu pun tak boleh test kat in utero tau, dyslexia.
Yes. Dyslexia usually di peringkat kindergarten and above. In some cases, bila masuk darjah 1 saja. And like what Anik said, masking sometimes with dyslexics. Dan saya pernah ada student lah, sebelum saya dapat tahu pasal Hans, even before I had Hans, I had a student in my tuition center who is dyslexic. He's now finished college, I believe. And his mom told me the story of how he was very clever to pretend to know how to read when he was in kindergarten. Sebab kan buku Peter and Jane ada gambar. Kan ada gambar dengan ada the words there kan. So dia hafal lah. Oh, gambar ni Peter, gambar ni Jane, gambar ni the dog kan. It's the ball. So dia hafal. So bila, and the mom had something that didn't sit right with her. So pergi ke kindergarten dengan anak, duduk dengan cikgu bersama. Dan the teacher said, anak you boleh baca. Tengok, and depan mak dia boleh. Tetapi dekat rumah buku lain tak boleh.
Yeah.
But this is also a story of a mom who never gave up lah. So when the son went into standard 1, standard 2, struggle more in school, they went for further assessment and found that he is actually dyslexic. And to cut a longer story short, memang dia boleh belajar just with some accommodations.
Yes.
And
dyslexic children do very well with the right intervention at the right time. So it's about, again, diagnosis and giving them the right intervention and accommodations.
And this boy, his best subject was English, and his best skill was writing essays.
Fantastic.
Yeah. He would write the most vivid and descriptive essays.
Fantastic.
Yeah. To a point, he even got sent to the school counselor one because he wrote a very vivid story about something that happened at home, which didn't actually happen.
His imagination went, wow,
he
boleh
has
belajar.
a very good imagination. So, anyway, Didi, what do you think on this topic?
Well, there was previously I did have a discussion with a clinical psychologist on IQ tests, where when we want to test IQ on children, autistic children, somehow it may not be as accurate as when it is done on typical children because of the issues that they have. That's kalau dalam assessment pun tak boleh dapat accurate, apatah lagi observation from the teachers in class. Kan nampak macam tak boleh belajar, tak boleh jawab soalan, but they are sebenarnya diorang boleh belajar tapi mungkin tak boleh nak jawab soalan, tak ada kemahiran nak jawab soalan, ataupun mungkin cara pembelajaran tu tak sesuai dengan mereka. Itu yang buatkan dalam situasi di Malaysia kan, sama ada anak tu pergi PPKI ke, mainstream ke, ataupun alternative education, parents already realise that the mainstream, the cara biasa SPM ke A-level ke apa, is not the only way to get to where we want our children to be in life.
Yes.
Kalau macam kita dulu memang macam kita kena ada SPM, we went through that kan, masuk university and all. So kita jadi lebih kreatif, kita lagi open, because we have to understand when it comes to autism, as it is a neurological disorder kan, the risk of them having mental health issues are higher than the general population. So we have to strike a balance between pushing them to really excel in education or finding a different path so that they would feel more comfortable lah. Because if they are not happy, it's hard lah for them to excel, and then there's risk of depression kan. So we would like very much to avoid that. But of course, things are always better when there's accommodation. Not saying that macam, oh, tak boleh ni, pergi sini. But with the right support, of course you can do more.
And with the right teachers that believe in you and parents.
Yes.
Yeah,
the people, the team that ada empathy, sanggup cari jalan, usaha lebih kan untuk anak kita. So that's the thing, macam so many things to consider. It's not about kalau anak orang tu boleh, kenapa you tak boleh? And then kita nak marah anak kita, anak dia autistik juga, tapi you autistik, tapi kenapa you tak boleh buat? Because they have different strength, and there's a thing about them where they can do very well in things that they are interested in.
Yes.
Very, very well. So in things that they are not interested in, susah. Sebab kan kalau typical, I think I spoke about it in a previous episode kan. Kalau kita dulu, bila kita pandai dalam semua subjects.
Yeah.
Tapi anak kita, dia punya profile very, what do you call yang ada yang tinggi, ada yang rendah. Dia
ada variation kan? Dia tak consistent.
Yes.
Dia tak consistent.
Yeah. So macam if you are not strong in maths, doesn't mean that you cannot do like other subjects. Exactly. If you're not language wise pun, walaupun you are very good in English, it doesn't mean that you can do other language like Malay. Macam my daughters minat Japanese, minat English, tapi bila nak suruh buat BM, it's just another, we would think that it's just another language and it's your mother tongue some more. So macam it should be easy. We feel that macam patutnya you boleh buat. Tapi she just couldn't. So the thoughts process and the reality, the expectation semua dah sangat berbeza lah. So dia, bila kita kata neurodiversity, the diversity is not just on the diagnosis, the diversity is like in how we are managing them lah, and supporting and creating opportunities for them.
Yes,
so
and how they learn.
Of course. Yeah, and how they learn. So nak kata boleh belajar, of course, but you have to count in many factors lah. Like, is there enough support? Is it the field that they like? They have interest in it or not? Bukan macam short sendiri, ataupun jangan macam because it's the only things that are available, whether you like it or not. Like the kid has to be in it. Like sampai stress, sampai parents dekat rumah pun dah tak boleh nak handle because anak dekat sekolah stress, dekat rumah pun lagi stress. So banyak faktor lah, banyak ni. So I think in education, like Malaysia education also, we have to consider to provide more options for the children, according to their interests and strength, of course.
I think the first thing saya nak acknowledge is that learning is hard sebenarnya.
Yeah.
If we look at it, sebenarnya benda-benda yang kita rasa mudah, macam bercakap, or even movement. Sebab sekarang ni Desiree tengah belajar lagi tentang dyspraxia. And as I'm reading about dyspraxia and the different senses kan, for example, vestibular, your sense of balance. Sebenarnya to get to that point of even taking a step or duduk atas swing, there's a lot going on in our brain, right through our nerves, right to making that movement. Banyak is actually a very complex thing. So imagine how hard it is for our kids who are over or understimulated. kan? And like what Didi said about learning, right? It reminds me of something one of the founders of Hans Center that he goes to said at their sports day, and that's why I love this place. They try to create activities for their kids that any other kid would experience, like sports day and whatnot. So he said, if the child cannot learn the way we teach the way they learn.
Yeah. And that's a
Right?
great educator.
Yeah. And
Yeah.
I have goosebumps when I say that. And so I just want to give a very quick example about our recent discovery with Hans, which I've shared, that in addition to autism and the apraxia, he is dyspraxic and he has dysgraphia. So the dysgraphia is something that I was completely thrown off. So dysgraphia basically is fine motor skills, biasanya handwriting. Memang susah untuk pegang pencil. Some of them hold that like a brush. And it also affects the executive functioning in terms of planning and writing essays. So they, in a child who is highly verbal, you would see usually the main sign is they can converse very well.
Yeah.
They have good in-depth conversation. They can tell you great stories. The minute you give them a pencil and a pen to write, they cannot write it. Punctuation, grammar, rules of writing is very hard for them.
Paragraphing,
Paragraphing.
word
and all that.
limits.
Yeah. So, and as my husband and I process this news, we were not upset or sedih ke that, oh, kesian Hans. Like, I was like, kesian me. Mami kena pergi belajar lagi, right? No, but I enjoy learning and reading, right? So that's okay. But my first thought, and even my husband's first thing he said was, please go out and tell people about this dysgraphia. Because imagine maybe parents yang don't have that kind of time like I have to read like hundreds of books, right? Tak tahu pasal dysgraphia ni, they would think that the therapy is not working. Oh, anak saya tak boleh belajar, anak saya tak boleh bertulis, berapa banyak OT pun memang dia tak boleh tulis. When that's not the reality. The reality is he cannot or she cannot do it because of the dysgraphia, and dysgraphia is not a hopeless diagnosis. There are many things which hopefully we will cover in future episodes on what you can do. Technology is one way you help. Kalau anak tersebut tak boleh tulis, type lah. And this is when we realize Hans sebenarnya dia boleh eja. This whole time I was thinking, oh, he can read, he cannot spell. He can read, he cannot spell. Dia boleh spell, just dia tak nak tulis. If you ask me to tulis cat, bat, mat every day for 6 months, saya pun marah sampai koyak kertas. So imagine this boy who can't speak. Cat, bat, mat, memanglah dia koyak kertas. Bila cikgu suruh buat. And now he is spelling 4-letter words. Book, look. You know, so so the point is memang semua anak boleh belajar. It doesn't matter what the diagnosis is. Semua orang boleh belajar. It's just how they do it.
Yeah, and kejayaan akademik adalah bergantung kepada kebolehan seseorang anak walaupun neurodivergent ataupun neurotypical.
Yes,
Dan
absolutely.
sokongan.
Dan
Jangan
sokongan.
Yes.
Yes.
Sokongan di rumah dan di tempat pembelajaran.
Tempat belajar. Okay, so I think we have a little bit more time to cover one last question, which is, anak autistik boleh kahwin tak?
Kenapa tak boleh kahwin?
What do you think, Didi?
Itulah soalan-soalan ni selalunya datang daripada mereka yang anak masih kecil. Jadi mereka perlulah berada dalam komuniti yang lebih besar. Komuniti autism ni besar sebab komuniti autism ni bukan hanya terjadi pada kanak-kanak. Mereka daripada kanak-kanak dia jadi dewasa, dah jadi datuk, nenek pun dah ada yang dah tak yang, and kan kita pun baru tahu orang pertama yang didiagnose autism pun baru je meninggal dunia beberapa bulan lepas. So sebenarnya autism ni bukan kanak-kanak saja. Jadi kalau you kena kanak-kanak je, mestilah you rasa macam kahwin. You pun tak, mana ada kanak-kanak yang kahwin kan. So macam boleh ke tak boleh. Tapi kalau you dah kenal, you dah dalam komuniti, you and sekarang kan makin ramai dewasa yang mendapat diagnosis. Maksudnya dapat diagnosis ketika dewasa.
Ya.
Bukan dapat diagnosis ketika mereka kanak-kanak macam anak kita lah. Jadi ada je yang dah berkahwin dan baru dapat diagnosis. Ada juga yang daripada kecil ada diagnosis and then kemudian berkahwin. So sebenarnya untuk tahu, kita perlu berada dalam komuniti yang besar dan barulah kita dengar adalah mungkin dalam bentuk anecdotes lah macam ataupun Facebook posting. I think baru 2-3 hari lepas saya approve satu posting someone yang dia cakap dia autistic dan dia sudah berkahwin. So sebenarnya boleh, tapi bergantunglah you nak ke tak nak dia, sebab kahwin even untuk orang yang tipikal bukan sesuatu yang wajib, bukan satu kemestian, bukan you perlu kahwin. You tak boleh tak kahwin. Tak, dia tak macam tu. Tapi seelok-eloknya, sebaik-baiknya bila nak berkahwin tu dengan keadaan individu tu sendiri tahu keadaan dia, dia autistik, tahu bagaimana nak mendapatkan support bila diperlukan, dan pasangannya juga yang boleh menerima dia seadanya dan juga boleh memberi sokongan lah dan memahami. Kan tak boleh lah macam I like you when you are like this only, tapi kalau you tantrum banyak-banyak I tak nak macam tu kan.
Unconditional.
It comes in a package.
Yeah. Kan? Yes.
And it's a wholesome package.
Yes. Anit?
Memang okay, kita ada spectrum kan, spectrum yang sangat besar. So there are those that are not able to make decisions for themselves, who are neurodivergent. And for those, this is why a few of us, and especially the entire Kita Family podcast community, have been very supportive of the push to have an act called the Mental Capacity Act ataupun Akta Keupayaan Mental yang kami harap akan menjadi kenyataan tidak lama lagi. Kerana memang ada push untuk mendapatkan akta tersebut seperti di UK dan di Singapura. Tetapi orang yang mempunyai kapasiti mental yang secukupnya, mereka boleh membuat apa sahaja. So mereka mempunyai neurodiversity, yang neurodiversity is not a bar to doing most things. So they are those with neurodivergence who have PhD. Takkanlah mereka tak boleh kahwin. Right? Tapi kalau their trait is not to, or their interest is not to kahwin, tu pilihan mereka.
Exactly. So jawapan saya senang je. Ada je orang neurotypical tak nak kahwin. Right? I think the decision untuk berkahwin is very individualized. So sekiranya tak kisahlah autistik ke, ADHD ke, neurotypical ke, kalau ada keinginan, ada pasangan yang sesuai, and marriage pun it's not easy kan. I think in most of our faith ada things that you have to adhere to from a religious perspective, from a legal perspective pun. So kalau seseorang tu bersedia dan mahu berkahwin ada pasangan yang sesuai, why not? Let's not limit it to anak autistik tak boleh, anak ADHD boleh,
anak dyslexia boleh.
So anak neurotypical mesti lepas tu mesti ada anak. No, there's no such thing as that kan. So on that note, I think we are coming to the end of this episode. Let's go around and see, Didi ada apa-apa final message untuk episod hari ni?
Well, memang waktu mula-mula dapat diagnosis kan, kita ada banyak persoalan, tapi please join community, sama ada online ataupun based on kawasan you. Macam sekarang saya di Sabah, join Sabah Autism Society. So you have to be in a community to understand the challenges, the future, gambaran kan apa yang akan jadi pada anak kita. You tak akan dapat semua dengan pembacaan lah. You really have to be in there, belajar daripada pengalaman yang ada daripada ahli-ahli group, support group kan, ataupun community. So be out there, find your family, find your tribe, so that you not just learn but also make things less hard lah kan. Kita kan bila bersama ni kita semangat lebih, and you can also support each other. So yeah, that's what I want to say lah.
Thank you, Didi. Anit?
I think the reason why we started this chit chat mak-mak anak neurodivergent was to bring out questions yang kadang-kadang akan menyakitkan hati seseorang ibu ataupun bapa bila mendengar. So if we make these conversations a bit more open, hopefully people around will listen and they may not ask those questions at a time where it could be sensitive, or those who are parents will be more willing to discuss it, to say, actually keadaan anak saya ni macam ni, dia ada kelebihan yang ini, dia ada kekurangan dalam segi yang lain, tetapi he's still my child, she's still my child. And we just want everybody to be inclusive, to be part of the society, which makes a great fabric, and make conversations like this a bit more normal and less sensitive.
Absolutely. We need to normalize this conversation.
Yes, we do.
Kan? And I have intentionally used the word normalize
Yes.
in this context. Dengan niat yang baik, ya. We always talk about niat as well. So, itulah episod ke-30 kami. Hopefully you like this segment of Chit Chat Mak-Mak Neurodivergent. Let us know in the comments on YouTube and even on our social media platforms, TikTok, Facebook and Instagram. And if you prefer to just listen to us on Spotify. We'd like to hear from you some of the things that you've heard in your discussions dengan parents lain ke, dengan kawan-kawan. Throw us some questions. Mungkin bolehlah kita bincang dalam segmen ni pada episod-episod yang akan datang. So with that, salam sejahtera from all of us at Kita Family Podcast. See you next time. Bye.
Bye.